and welcome to NAFDAC and your else. Every week on the program, we provide you with insightful information about NAFDAC's activities aimed at protecting the health of Nigerians. I am your host, Tosin Omolaja. Today on the program, we bring you some of NAFDAC's activities spanning investigation and enforcement and the agency's strides in meeting the nation's needs in combating the novel coronavirus. The production of counterfeit, fake and unwholesome drugs and other regulated products are an alarming reality in our society. Even as COVID-19 pandemic continues to menace the world and indeed Nigeria, unscrupulous elements continue to perpetrate their vicious trade. However, the Investigation and Enforcement Directorate of the agency is not resting on its oars and has heightened surveillance, seizure arrests and prosecution of counterfeiters across the nation.
The Investigation and Enforcement Directorate is very, very important to our mandate, just like any other directorate. They've already arrested 162 suspects, from 2019 to date. 166 seizures of different drugs illegally or brought into the country or unregistered. They've done a lot of raids coming from informants or from just doing regular raids that they do very well now, and they also do raids on drug hawkers because people sell drugs or herbal medicines that they don't store at the right temperature and that you didn't even register, and they also sell narcotics. So these are the types of activities that investigation and enforcement does. That directorate also collaborates with Interpol, with different intelligence agencies in the world to ensure that drugs that are illegal or narcotics do not come into the country. They do a lot of prosecution. They do a lot of course, seizures. They do a lot of destruction. For example, last year we destroyed tramadol worth 1.7 trillion naira. That is the street value. So all these things make up investigation and enforcement. A lot of raids. For example, the raid that they did in Ibadan, where in a very private house, somebody was making medicines and putting the label of some companies in Nigeria on the bottles. So these are activities examples of activities that investigation and enforcement does on a daily basis. And it is continuous. It is not like, oh, we finished for this year, we will not again. Because bad merchants do all this on a daily basis, and we have to continue to step up. The work of investigation and enforcement is not just the work that the staff there usually do. It is collaboration with the society. It is collaboration with the community. NAFDAC generally, we cannot be successful without the citizens, without somebody giving us or people giving us tips that, oh, I suspect that something is happening here, you can check it out, I don't know whether it's true or not, and we step in. So the community agency interaction has to be increased in terms of collaboration or just informants doing their job. It is informants that help the directorate in a big way to lead us to where illegal activities are being done. So extremely important for the public to collaborate, to call NAFDAC. We have 800 number.
NAFDAC's toll-free numbers are available on the agency's website and across all its social media platforms. These have been effectively used by well-meaning members of the public who continue to work with NAFDAC in the fight against counterfeiters and illegal producers of regulated products. This such tip-off led to the arrest and prosecution of the Ibadan suspect who confessed to adulterating cough mixture with banned narcotics.
Imagine manufacturing drugs in the toilet. What it means is that even before he started doing what he does, people are already dying. Imagine that. How can someone unknowingly pay for his debt or her debt? That's what we are being confronted with. And for us at NAFDAC, counterfeiting anywhere is counterfeiting everywhere. That's how we see it. It's not about a location. It's about all of us. We are all in it together. So if this type of young man cannot be tolerated, his activities, and more so, lives are involved. We should be interested in what people are doing in the neighborhood. You should be able to tell us when you see such an act, someone compounding medicine. The young man didn't go to a pharmacy school. He's not a pharmacist. Even if he's a pharmacist, he cannot produce drugs in such an environment. He needs registration. He needs registration by NAFDAC. Drug is not an all-comers affair. Drug is a serious business. It's not akara. It's not bole. It's not granite and banana. It is serious. So it should be seen that way.
Based on another public tip-off, the agency was able to apprehend another illegal producer of fake and unwholesome herbal mixtures in the Ikorodu area of Lagos.
As far as investigation is concerned, immediately, NAFDAC investigation enforcement receives, this kind of petitions, whether from right holders or from anonymous complainants, we soak into action. And exactly that's what we have done. So we don't dilly-dally over such matters. So that's what happened. We are always on our toes to see that the needful, we have done the needful by way of, getting the suspect arrested when we have such complaints. And when the Director of Investigation and Enforcement got that petition, he constituted a committee that swung into action and went to number 11 Oladapo, Olomo Street, Berigbe, Ikorodu, Lagos, where the man, Mr. Yusuf Wasiu, was producing, fake herbal bitter drinks. The drinks are as follows: Okiki, Ebile VIP alcoholic bitter; Ogogoro, Ebile Amotekun; Japata alcoholic bitter. And they found the man in the real act of the production. So, and he was arrested and brought to the office. His statements were obtained. The products were sampled against him for laboratory analysis. And it will interest you also to know that he was also caught with large quantity of Indian hemp, and which he was also processing into a PET bottles. Apart from the raw, part of the products he was found with, he was also processing them into PET bottles. So, and eventually some samples were drawn from the, from the bulk for laboratory analysis to confirm whether they are really marijuana or not, which will now enable us eventually to hand him over to NDLEA based on the synergy that exists between, various agencies of government. So we are eventually going to hand him over to NDLEA. So he was arraigned, and the charge were read to him, which he pleaded not guilty. And we applied that he should be remanded pending, trial. So his lawyer eventually applied for his bail, which, the court granted in the sum of 5 million naira, one surety, and then the surety should be a public servant, not below grade level 8, and the prosecution should verify the surety. So the matter was adjourned to 21st, October 2020 for trial. Basically, that is his right now. As I'm talking to you, he's at Alabon, force here at the Alabon detention facility, pending when he will perfect the terms of the bail.
The suspect was also found to have been falsifying NAFDAC registration numbers and misleading the public.
We saw conspicuously, written NAFDAC registration number on the PET bottles of the products. So, which we found out that he has not obtained the license of NAFDAC, before he now went into the reproduction of those products. So he's like misleading an ordinary consumer who may believe that these products were registered with NAFDAC, while the products are not.
Despite being caught in the act, the NAFDAC spares no resource in doing due diligence by verifying the contents of the various mixtures in its laboratory to ascertain the extent to which they are injurious to public health.
It's part of the investigations. After the samples were drawn, we subsequently we sent it. We sent it to the lab for analysis, and the laboratory analysis will now tell us whether there are some foreign particles or whether they are wholesome or not. So, and that is, but strictly speaking, by the provisions of Section 1 of Counterfeit and Fake Drugs and Wholesome Processed Food, the mere fact that a product is not registered, the law considers it as fake, notwithstanding the fact that the chemical aspect proves otherwise. So the law assumes that the products, any product that is not registered is considered fake. So, but we just want to play safe. We have sent it to the lab because you cannot, speculate to say a product, is drugs or drink without subjecting it to chemical analysis. That is exactly what we have done. Just to show transparency on our own part, the sampling is done in triplicate. We give one to the suspect, we keep one, and we send one to the lab. This is to show that a kind of transparency. We don't hide anything. So, and then after that, the suspect is arraigned.
Despite the judicial hurdles, the agency is relentless in its effort to clamp down and prosecute this crop of antisocial elements within our society.
We have to do it. We have to do it because if you relent, it's not serving any deterrence, because if eventually you get frustrated from what has happened, public are watching. They will start asking, what happens? Suspect A was arrested. Eventually, nothing comes out. He's in the market, doing, all the illegalities again. So we are not relenting. We are still doing the needful.
Our mandate is to safeguard the health of the nation. And the focus of Investigation and Enforcement Directorate is to safeguard the health of our people. If a young person or an adult is on drugs, they can commit murder, they can steal, they can kill, they can become terrorists. So this is extremely important for us as an agency, and we take it very, very seriously. That in order to have a safe society, we've got to control the use of narcotics and other illegal medicines. It's for the sake of our country and the health of our people that we are doing all this job.
We'll take a short break now. Stay with us. Welcome back.
The advent of coronavirus has brought about an unprecedented need for the mass production of COVID-19 rapid diagnostics test kits across the world. Although this crop of test kits are not yet readily available in Nigeria, the agency is proactive in its preparation for when these test kits will become available locally. It therefore recently organized a training workshop for its scientists and other relevant directorates, equipping its workforce to ensure COVID-19 test kits made available to Nigerians are effective.
The main reason why the workshop is organized is that we want to improve our knowledge and develop new skills at testing and validating COVID-19 tests. COVID-19 is a novel disease. The virus is new. At the National Control Laboratory for Vaccines and Biologicals, we have been handling different kinds of biological products before. COVID-19 virus is similar to other viruses we have been handling and testing in the lab. But because it is new, we have to validate all the test methods to make sure that any test report we generate from here, it is actually acceptable and it meets international standard and specification. So a lot of efforts are going on all over the world in different laboratories, in different areas of COVID-19 testing intervention. Some laboratories are developing vaccines, some are developing testing materials, some are developing diagnostic kits. The workshop we have organized today is to make sure that all the test kits that are brought into Nigeria are tested through validated method. And the validated method means that any test kit that we pronounce on, we don't expect test kits to give you false negative or false positive results. It must give you the actual status of the person that the test kit is going to be used for.
As you know, that the goal of our DG is to have a world-class laboratory. And in having a world-class laboratory, you have to ensure that your processes are of international standards. So the workshop we're having presently is to ensure that whatever tests we perform on the COVID-19 test kit is of international standard. So it's a very, very important training we are going through right now because we want to ensure that all what we do is of best practices from the beginning to the end. So right now we have our staff, all our personnel, our analysts attending this workshop presently so as to be knowledgeable on the best practices in evaluating the COVID-19 test kits when they come to Nigeria. So we are being prepared, So as the test kits come into Nigeria, we are well trained, we have the expertise in carrying out the evaluation of these test kits.
The facilitator for this training, we recruited him from United States of America. His name is Dr. Azubike Ogala. He's a renowned research scientist. He has been practicing in the area of molecular biology. He has vast experience in manufacture and production of test kits and diagnostic kits for different disease conditions. We are going to do some hands-on demonstration in the laboratory. He's going to coordinate all these things virtually from the United States of America. So we quite appreciate his effort. Actually,
it's not really new to us in testing, evaluating test kits, evaluating test kits. It's not something that is new to us. But the difference in this testing is that, in this training, is that the resource person wants us to know that we have to use characterized samples, well-characterized samples for the testing of our test kits. That is the special part of this training. Because if your samples are not well-characterized, you could have a false negative, or false positive result. So this training is especially more about having well-characterized samples to carry out the evaluation of our rapid test kits, the COVID-19 rapid test kits.
Basically, sample characterization is just to confirm that the blood samples or the serum or plasma that we are using, we actually know the exact concentration of whatever thing we are analyzing. For example, for this particular sample, we are talking about is COVID-19 panels. And this panel, or the plasma, contains antibodies. And you have to verify the exact concentration of the antibodies present in the blood sample. So we use a reference method, which is the PCR, to carry out the analysis to know that, okay, this is the concentration of the antibody present in the samples. So we'll be able to now use it to test the rapid test kits to validate exactly the way the manufacturer is claiming to be. That if the manufacturer says the kit is able to detect antibodies present in a patient, the panel will verify that.
The workshop, which spans 2 days period, covered both a theoretical and practical session to enable participants hands-on experience in analyzing COVID-19 test kits.
And the training has been very educative, very, very educative. And so far, we've known how to characterize our samples, how to validate our samples. You know, when test kit comes in, with the panels that we have, we can validate the test kits, and it can stand out anywhere.
Rapid diagnostic test kits are much more affordable and a faster way to test for the presence of COVID-19 in any given patient. This will also ensure that many more Nigerians can easily get tested and be sure of their status, thereby strengthening the country's fight against the novel coronavirus.
The screening now is used basically based on PCR, and PCR is very expensive and can only do minimal tests. So to cover a country like Nigeria, about 200 million people, is very difficult. That is why rapid test kit is very, very important. NAFDAC as a regulatory body, yes, we want to make sure that evaluation of rapid test kit is done, and is done with acceptable international standard. So we have gotten panel from international organizations, from the US, that's what we are using to do this, and are already characterized with PCR. They are PCR characterized, and that's the gold standard for characterization of specimen to be used to carry out evaluation on rapid test kits. So that's basically what we are doing today. But after this training, yes, with our experienced staff, we'll be able to screen, evaluate rapid test kits that will be used for COVID-19 screening. And that will help the country a lot.
Beyond COVID-19, the workshop was also designed to improve NAFDAC's laboratory activities generally, in ensuring that it continues to actualize its mandate of safeguarding the health of the nation.
The eventual goal is to make sure that Nigerians have access to good medicines, but also other services that are related to care, giving care to sick patients. In this instance, we are looking at stopping the spread of COVID-19 virus, and we do that by so many means, but equally, if we are able to test sufficient number of people real time, and we get good and reliable results, we can quickly isolate people that are infected before they infect other people. And the kits that are going to be tested and validated and pronounced on in the laboratory, we give further assurances to field officers that they use this kit, they are not going to get false negative reports. They are going to get the actual result of their patient.
That's all we have time for on the program this week. Make it a date for another insightful edition next week, same time, same station. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food product peddlers, our doors are always open.
You can reach NAFDAC via toll-free numbers. For inquiries, call 0700-162-3322. For complaints, please call 0800-162-3322 or email nafdac@nafdac.gov.ng.
Importing, producing, distributing, and selling fake drugs and cosmetics, adulterated food, and so on are criminal activities that destroy lives. Join the fight against these heinous crimes by reporting any suspicious activity in your area to NAFDAC. Let's join hands to safeguard the health of our nation. See you next week. Stay safe.